Hello, my name is Co Mai Duong. I am a Pharmacist Candidate class of 2022 from California North State University. Today I'm going to talk about one of first generation antipsychotic agent. It is Thioridazine. On the slide here we have the Thioridazine with different strength from 10, 20, 50 and 100 milligrams with the brand name Melaro. Some patient consultation. What is the drug used for? It is used to treat schizophrenia who fail to respond adequately to treatment with other antipsychotic drugs. What do I tell my doctor before taking these drugs? If you have allergic with the drug, if you are allergic with any other drug, food, or substances, if you ever had a long QT on ECG or other heartbeat that is not normal, if you have low potassium, if you are taking any of these fluoxetine, fluoxamine, paroxetine, pindolol, or propranolol. What are some side effects that I need to call my doctor right away? Even though it may be rare, some people may have bad or sometimes a deadly side effect when taking this drug. Tell your doctor or get medical help right away if you have any of following sign or symptom that may relate to very bad side effect. Sign of allergic reaction such as rash, hive, itch, red, swollen, blistered, or peeling of skin with or without fever. Trouble controlling body movement, twitching, chin imbalance, trouble swallowing or speaking. Fast or abnormal heartbeat, chest pain or pressure, mood change. Some people may have muscle problem called tardive dyskinesia. This problem may lessen or go away after stopping this drug, but it may not go away. The risk is greater with diabetes or in adults, especially older females. The risk is greater with longer use or higher dose. What are some other side effects? All the drug cause side effects. However, many people have no side effect or only have minor side effects. Call your doctor or get medical help if you have any of these that not go away. Diarrhea or constipation, upset stomach or throwing up, dry mouth, feeling sleepy, stuffy nose. Thioridazine is used to treat the schizophrenia who fail other treatment because of insufficient effectiveness of other medication or the inability to achieve an effective dose because of intolerant side effect of other medication. So essentially it's the last slide. A mechanism of thioridazine. Thioridazine is an antipsychotic agent, first generation or typical. Thioridazine is piperidine phenothiazine. It blocks postsynaptic mesolimbic dopaminergic receptor in the brain, and it has activity at serotonin, noradrenaline, and histamine receptor. There are many interactions of thioridazine with other medications, such as the medication that increase the QT prolongation, for example, ondansetron, fluvoxamine, fluoxetine, olanzapine, the drug that enhance the side effect of anticholinergic drugs, seen as depression medication, anti-Parkinson agent, azilastine, promopri, carbagoline, chlorpheniramine, especially CYP2D6 inhibitor that it increase the serum concentration of thioridazine. Some pro and cons. Pros, it is low cost, it's low risk of increased prolactin and press discharge, low D2 antagonist effects, and less metabolic abnormality. There's some con. There is last line of therapy, only available in oral formula. QT prolongation is towards the point and sudden death, and avoid in patients with 65 years or older. For dosing and administration, initial dose is 50 to 100 milligrams 3 times daily. Dosage may be increased gradually. Max dose is 800 milligrams per day. For children 6 years or older, initial dose is 0.5 milligrams per kilogram per day. Maximum initial dose is 50 milligrams per dose. Gradually titrate to clinical response, and the max dose is 3 milligrams per kilogram per day. Some main side effects, they are cardiovascular related, such as ECG change, hypotension, orthostatic hypotension, central nervous system such as confusion, disrupt temperature regulation, drowsiness, drug-induced Parkinson's disease, dermatologic, endocrine and metabolic, gastrointestinal, genitourinary, hepatologic and oncologic, and ophthalmic, such as blurred vision. Warning and precaution. Black box warnings. It has been shown to prolong the QT interval in dose-related manner. This may potentially cause towards at the point and sudden death. Elderly patients with dementia-related psychosis treated with antipsychotic are at an increased risk of death compared to placebo. Disease-related concern, cardiovascular disease that I mentioned earlier, dementia, hepatic impairment, and seizure. Monitor parameters, efficacy, ECG, CBC, fasting lipid panel. For safety, mental status and alertness, weight, height, BMI, waist circumference, electrolyte, renal and liver function, change in menstruation, libido, abnormal involuntary movement or Parkinson sign, autonomic instability, fall risk, ocular exam. There is no dose adjustment for renal or hepatic impairment. And this is my references. Thank you.